Okay, so the first test I'm going to do is called Tinels test, also known as the Fallon maneuver. So to perform this test, you put your patient in a seated position with their elbow flexed at 90 degrees, and this test is used to diagnose ulnar nerve irritation. So ulnar nerve sits in between the olecranon process of the ulna and the medial epicondyle of the humerus. And to perform this test, you just tap your index finger on the ulnar nerve, and if there's tingling down the ulnar forearm, medial part of the hand, and medial 2 phalanxes, then that's a positive test. A good way to remember this test is Tinel tingles. So the next test we'll be performing is called the Mills test, and it's also known as the tennis elbow test. It's used to diagnose lateral epicondylitis of the elbow. So to perform this test, you put your patient in seated position, elbow flexed at 90 degrees, and you place your hand on the lateral epicondyle of the humerus, and you get your patient to pronate the forearm, flex the wrist, and extend the elbow while keeping your hand on the lateral epicondyle. And a positive sign would be if there's pain while they're doing the action. The next test is called Froments test, and it's also known as the pincher test. So this test is used to diagnose palsy of the ulnar nerve, specifically the action of adductor pollicis. So to perform this test, you place a patient with a curled fist, and you place a piece of paper in between the index finger and the thumb, making sure the thumb's flat on the piece of paper, and you just try to pull the piece of paper away. And a positive sign would be if they use their flexor pollicis longus and flex their thumb to compensate for the ulnar nerve palsy, and that would be a positive sign.